Edinburgh is a city rich in research into diabetes from a number of different institutions. Attendees today therefore underlined how crucial it was to share information, especially as new discoveries take shape.
So today we are recognising the breadth of diabetes research that's taking place across Edinburgh, both the basic science research, the clinical research, the big data research, and getting together clinicians and scientists, mathematicians, bioinformaticians, and really recognising what we do and forming collaborations here as well. In type 1 diabetes, it was thought previously that people had absolutely no insulin production whatsoever, but we're now recognising more and more that actually there are people who have some residual insulin secretion capacity. And those studies, a lot of those have actually been done in Edinburgh. And a lot of the studies now, and we're just one centre in the UK, but a lot of the studies now are trying to preserve insulin secretory function because we know that that has benefits.
There is also a matter of a practical approach towards type 2 diabetes for both this generation and the next.
So I think we've got a really good opportunity in Edinburgh to investigate lots of different aspects of type 2 diabetes. And personally, I've been involved with a big study in Edinburgh called the Edinburgh Type 2 Diabetes Study, in which we recruited 1,000 people with type 2 diabetes who were in their 60s and 70s. And then we've been following them up over around a 10-year period to look at different rates of complications and also to understand why people might get complications. We've got lots of basic science work that's going on in the department here in the Centre for Cardiovascular Science, which is really focused on trying to understand some of the reasons why people get type 2 diabetes, particularly interested in the way that there are changes in fat, for example, and then also other organs, so kidney, muscle, and the liver. So that's some of the basic science that goes on. Another area where we're really working a lot, which is work that I do, is around pregnancy and diabetes. So in Scotland, we've got some of the highest rates of obesity among young women, and so we're seeing an increasing number of women who develop diabetes in pregnancy. We call that gestational diabetes. So we've got a special clinic where we see these women and look after them during their pregnancy, but importantly, that gives us an opportunity to try and prevent them from getting future type 2 diabetes.
The combination of fresh research and communicating these developments with one another, staff and patients will hope, can prove beneficial and give a real sense of purpose to Edinburgh Diabetes Day. Ian McNally, That's TV.